I was recently invited to be faculty at the workshop at the International Society of Hair Restoration Surgeons that was held in September in Boston. And there were about 50 doctors that enrolled from different branches of medicine, plastic surgery, cosmetic surgeons, dermatologists, etc., that took the course to increase their skills in doing these procedures. I taught the part of the workshop that focused on the design of the donor area, taking of the tissue. The design and the harvesting of the donor area. You have to determine how big a procedure it is that you need to be able to not only meet but exceed the goals of the patient, and that is complicated. Depends on the hair characteristics, on how big the area is, where the hair loss is, etc. But once you know how many follicles you're going to need, then you look at the donor area and see what the density is. Let's say that the density, to make things easy, and the density comes out to be 100 follicles per centimeter square. Well, if you need 3,000 follicles, then that means that you need 30 centimeters square of tissue, of scalp. So if the donor area is about, let's say, 25 centimeters long, then you can take a strip that's 25 by 1.2. That gives you 30. But actually is not as straightforward as that. It varies because tension and elasticity changes along the length of the strip, and you have to account that. The sides are pretty elastic, and then there's an area of decreased elasticity where there's greatest tension, and then in the back there's less tension again. So it just narrows on the sides in one spot and then expands again. So you have to have a feel for these things so that you can close without tension and deliver that fine invisible scar that you shoot for in every patient.